admit all, but
Welcome, everyone. Thank you so much for joining today's webinar. We're going to give it just another minute to allow some folks who are in our waiting room to come join us, but we're so grateful to have you here. Thank you all for coming. My name is Jennifer McKennis. I am a program manager in our training department at Mama's Voices. And today we are so excited to introduce to you a resource called a pregnancy plan. We're going to share recommendations for how this plan could be implemented by providers. And we're going to offer some suggestions on how this plan could actually serve as a foundation for a quality improvement project that you could engage patients or family partners in. Throughout the duration of the presentation today, we are going to leave questions to the very end, but I invite you to include your questions in the chat as we are moving along, and then we'll take a look at those towards the end. So this is the second webinar of a 4-part series on supporting patients who have lived experience in substance use disorder throughout their pregnancy and supporting them through the postpartum period. So our very first webinar was all about engaging patients with lived experience in SUD into quality improvement work. We also shared our best practices on facilitating a listening session. If you didn't get the chance to attend, you can find the recording of those webinars on our SUD resource hub, which is available on our Mama's Voices website. And we are going to display a QR code of that later on. So you can dive in and see the resources that we've created at Mama's Voices and also the wonderful set of resources we have from trusted partners. So these last 3 webinars that we're going to conduct are going to introduce pregnancy resources that you could use to customize care really for any patient, but we especially focused on making sure it was customizable for caring for those with lived experience in SUD. So today we're going to introduce that pregnancy plan. We have our next webinar on May 22nd, and we're going to share a resource offering a patient-centric screening process. And then our final webinar will be on June 11th. We're going to launch a coping mechanism management resource. We're really excited about these. So how did these resources come to life? At the core of all the work that we do at Mama's Voices is a simple belief: the patient voice should be at the heart of every project, not just as a participant, but really as a partner. And that's what we tried to model during the process of creating these tools. So we began by holding listening sessions with individuals and family members who have lived experience in SUD. And that gave us the chance to have really honest conversations so we could have a clear understanding of what was missing and also what mattered most to the patients. So after those listening sessions, we then created a work group consisting of some of our certified patient family partners. And that group really played a key role in developing the content that you're going to see today, making sure that every word, every suggestion that we gave, really every message reflected the real needs and the real perspectives of patients with lived experience in SUD. And then we had very specific elements of the tools. For example, today you're going to hear about provider script samples that we're going to offer you. We invited some of those same work group members to work independently and create content. And then they also had the opportunity to review some of their peers' independently created content. So we're hoping what this created through several stages of the process is something that is authentic, it is informed, and it's truly patient-centered. And we're going to dive into those resources in just a moment. But you might be sitting there thinking, how could these resources tie into your quality improvement work? So we work a lot with PQCs and hospitals, and we are teaching them about patient engagement. And one of the things that we hear so often is they've recruited the patients, they've onboarded them, they're really excited to get them working on something, but they're just not sure what type of project to bring them into. So we are giving you today and then at our next two webinars are three concrete examples of pregnancy resources that could be used as is. They are finished products, but you also could use them as a foundation for a quality improvement project with a patient. So we know that communities have really unique needs and also very unique access to resources. So for example, the pregnancy plan that you're going to see today, you could use that as a starter template for a project. For example, you could convene a work group of patients and providers, and their objective would be to take this pregnancy plan we're sharing today and really tailor it for the needs and for the resources that are available in your community. Okay, let's dive into this very first resource. So what you are looking at here is a preview of two of the components of our pregnancy plan resource. So on the left side, you'll see a little screenshot. That's our provider implementation guide. And that includes a lot of best practices and also sample scripts for providers to support very respectful conversations with their patients. I'm going to walk you through some of the highlights of the implementation guide today. And then I'm also going to pull up our pregnancy plan and walk you through some pages of the pregnancy plan. And that's what you're seeing on the right side is a little sneak peek of that pregnancy plan. So how do you integrate this into the care of patients? We're first going to share, what we would recommend and how you use this with providers and with patients. So our vision for this is really that this plan will live in a patient's medical record, making it accessible to OBs, MFMs, therapists, nurses, care team members, especially accessible to the patient. If you have a patient portal, that would also be a great place for this to reside. We know that that might depend on what you have access to within your own organization. And so that's an area where you might want to tailor this so that it suits how this document can truly live in the patient's medical care record. Our vision is that this is a living document. It is updated as the pregnancy progresses. So this is not a one and done form. This is not a form where you do it right before delivery and then everybody reads it right before delivery. Our hope is that providers introduce this early at the very first appointment, if possible. And then ideally, one section is completed at each visit or added or revised maybe as new developments come about, just to make this a more manageable process time-wise, because we know that time is limited when you have appointments, when providers have patients in the room. And so choosing to address one small section at a time just might make this a little bit more feasible for you. And our most critical advice that we would give is for this to be a true collaboration between their care team and between the patient. So what would the implementation of this look like? So as I mentioned, we would want this to be a living, breathing document. It's revisited, it's refined throughout that entire journey. So here's what we would recommend. The provider introduces this concept at the very first appointment or very early on in their prenatal care. And then they begin by completing the initial sections with the patient. Make sure that plan is placed in their chart or it's placed in their medical records, if that's a possibility, so that any other members of the care team who might visit with them can access that. And then you use each appointment as an opportunity to revisit the plan. Go back in, update, complete new sections. Have there been new clinical developments in the patient's pregnancy? Maybe the patient's preferences have evolved over time. Sometimes they're becoming more informed, or maybe their personal circumstances may have changed. Again, this is intended to be a flexible document that grows with the patient's journey. As you get closer to delivery, Provide that patient with a final copy of their plan. Consider having a plan for their partner or for their support person, for anyone who might be an important critical member of their team and their care team. We want to make sure that they feel informed, that the patient feels supported, and that they feel in alignment with their care team before they go into labor. We do realize that circumstances might warrant them delivering with another provider or at an unexpected facility, and that's why we believe physical copies might also be helpful for them to have with them. And then lastly, that pregnancy plan, it doesn't stop at delivery. So during postpartum care, you want to continue to review the plan, adjust for any discharge instructions they may have received as their needs change, if there's any follow-up care that you're recommending, and really any concerns that the patient might have. At every step, we really want to reinforce communication and continuity across their care. The creation of that plan, it's really more than just checking selections off of a list, and you're going to get to see the resource in just a few minutes. It's a conversation between patient and provider, and we want that conversation to be rooted in trust, in respect. We really want it to feel like a partnership, and we believe that that process will support true patient-centered care. And that starts with shared decision making. So the plan is co-created by the patient and the provider, but it's grounded in what matters most to the patient. And that includes maybe their birth preferences, some of their goals, and especially the roles of their support system. Respecting patients' values is equally important. Every patient brings a unique identity, a unique history, a unique set of values to their care. They may be carrying past trauma into this pregnancy. They may be carrying past experiences into this pregnancy. And we hope that this plan really creates a space to honor their dignity, their experience, their autonomy, their cultural and spiritual beliefs. And of course, education and support is critical. So patients deserve to feel informed. And our vision, our hope is that this plan really opens up a two-way dialogue so that providers can explain options to patients. They can outline potential risks. They can share their medical recommendations, but ultimately empower patients to be a part of the decision. And we do realize medical interventions may be necessary, but if we can inform the patients at every step of the way, that's what we want to do. We're really centering the care on the individual. We want them to feel like they are connected. We want all parties to feel like there is clarity, and we want compassion to be there at every step of the way. So as you are creating this plan, we do believe that communication is going to impact how helpful this process is for both the patient and for the provider. So we wanted to share with you some of the best practices of communication. For example, you want to actively listen to patients. You want to rephrase what that patient is saying to confirm your understanding of what they're trying to communicate to you. Check in often because patients' preferences can change throughout the duration of their pregnancy. They can change during the postpartum period. Be really transparent, especially when you are making clinical recommendations. And then sometimes those clinical recommendations might shift throughout the duration of the pregnancy. Provide explanations to them. And when possible, offer them any take-home educational materials that you might have. We recommend you always encourage self-advocacy. We want patients to feel safe speaking up, especially if they have concerns. And then, of course, ask open-ended questions so that it invites patients to really express what matters to them, as opposed to yes, no answers. You don't learn as much about the patient's wishes. So let's talk about how we can support patients with lived experience in SUD. So we want to be very thoughtful when we are customizing plans for them. So you want to consider adjusting the pregnancy plan based on what your organization's available resources are. For example, Does your facility have the option of nitrous oxide for patients? If it does, you can keep that in the plan for them to choose if they wanted to consider that. If your facility does not have that as an option, you would want to remove that as an option from their plan. You want to plan to discuss with patients their wishes for managing pain during delivery. You want to determine, are there special considerations for patients on medications for opioid use disorder or for patients on a medication-assisted treatment? Discussing both medication and non-medication options with the patient is really important to make sure that their pain management wishes are aligned with their treatment plan. And the most important thing is that they've had the opportunity to communicate their wishes to you. Connecting them with resources is so important. And we recommend you don't have to wait for them to ask for access to resources. Those resources might include connecting them to things like addiction specialists, local inpatient and outpatient support opportunities. Are there peer mentor organizations they can become a part of? And the last area we want to mention is support people. They are really crucial to patients, and their roles should be clearly defined before labor and before delivery happens. So you want to work with patients to identify who is their main support person, who's on their team, discuss roles like who's providing the emotional support, as opposed to maybe who is there to help provide comfort measures. And then especially, is there someone who is a support person for them who is going to serve as their patient advocate if it's needed? You can offer alternatives like doulas and discuss how a doula's role can be incorporated in the pregnancy. You can include a communication backup plan just in case the patient is unable to speak during or after labor. So knowing who the primary contact would be so that you can communicate information to them and that they can communicate back to you. And then always be mindful of family dynamics, cultural practices, past traumas, language barriers. These can all have a tremendous effect on how families engage in the care process and can have a huge impact on the pregnancy experience for the patient. So all of the items that I've addressed so far are included in the pregnancy plan implementation guide, and there are a few others in there. As we mentioned earlier, it also includes sample scripts for providers to use. And you can see a little screenshot here over on the right side. This language was written by patients with lived experience in SUD, and it was designed to be supportive, to be non-judgmental, to be empowering for the patient, and also to give the provider the confidence to have these conversations with the patient. And it's broken down into the sections that you could see listed over on the left side. And it includes things like how to explain the purpose of the tool. It includes language on how to build trust and normalize feelings that they might have during the process. And then, of course, explain what happens next. Okay, so now that we've talked about how you can implement this pregnancy plan, I want to dive in and actually look at the plan itself. So the plan is 4 pages, so it would be 2 pages front and back. Although, if I'm being honest, we could have made this 10 pages. We tried to keep this short and manageable because, as I mentioned before, we know that the time together in an office can be very limited. So we tried to keep this as concise as possible. And you can see on this opening page, it addresses information about their pregnancy, their care team, who their support people are, and what roles they might play. Remember, this is intended to be a document that is helpful to both the patient and provider. And I'll let you dive a lot more into this on your own time, but I wanted to highlight a few of the areas that we would especially recommend you consider when you're customizing this to reflect your facility and your community resources. So on this second page, you can see there's a section called important dates, and this will be different for every patient. They would like to know what the cadence of their appointments are, their ultrasounds. When are they going to have screenings? When is their glucose test? If this is their first time mom, they might not know any of those things are going to be coming down the line. When should they start monitoring fetal movements? You know, that 26 to 28 week range. As the patient transitions from their second trimester to the third trimester, we realize the cadence of those things might also change. So it's okay to continue to revise this along the way. It's just a good opportunity for you to start to plant the seed in advance for what patients should expect is coming down the line. As early as possible, if you can allow them to book their appointments, their scans, it allows them to maneuver their own personal schedules to make that work. So the rest of this page is really going to focus on opening up that dialogue about pain management options. And that is a very personal choice. So do they prefer medicated or not medicated options, or are they okay with a combination of both? So we asked that very introductory question up here. And then on the left side, you can see some options for those non-medicated pain management. And then over on the right side, you can see some options for the medicated pain management options. As we get to this third page, you're going to start to see more of the preferences that might be familiar to you. So things like, would they like to delay cord clamping? Would they like immediate skin-to-skin contact? What if they wind up having a C-section, or perhaps they know in advance that they're going to have a C-section? And at the bottom section here, you can see there's an opportunity for them to ask questions about some medical interventions. We know these aren't going to apply to everybody, but we wanted to give them the chance to ask for information if they wanted to have that. And one thing that I will continue to reiterate is this resource that we've created is really intended also on our end to be a living document. So we invite all of you, if you take this pregnancy plan and you start using it, or you send it to providers to use, or you decide to customize it for your own populations, and you have feedback for us, we would love to hear that. And I'll talk a little bit more towards the end on how you can get that feedback to us, because we would continue to reform this plan to make sure we're providing the best resource for all of you. We try to really include languages in here that are inviting them to ask for more information. So you're going to see, and I'd like to know more about this. We wanted to, again, empower patients to ask questions if they wanted to. And that would really educate them so they can make the right choices for them, whether they have to make that choice now or whether they have to make that choice later. And so on this last page, you can see on the top, after delivery preferences. So they're going to ask things like photography options. What would they like to happen with the placenta? Did they have plans to take that home? Did they want it weighed? Did they want it to send it to pathology to help inform future pregnancies? So you'll recognize there's a whole section here on feeding options. And I really want to talk about what you see at the bottom of this page. And so what we have included here is two sections that we believe are really critical to support all your patients, but especially to support patients who might be experiencing non-medical drivers of health. So on the left side, you can see the title is I might need help with, and they have the option of sharing areas where they might benefit from access to local resources. So you can see food, diapers, transportation, housing. And in that housing section, we would include with that Let's say you're working with a patient who has lived experience in SUD. If they wanted to explore inpatient care options, or maybe after inpatient care and they are transitioning out, what happens next and what's available in your community? This is an opportunity for folks who are going to customize this to really tailor it for what is available in your community. Over on the right side, you can see the Safe Start checklist, and that includes the chance for them to request education on things like safe sleep practices for them or for their family members. They can request mental health support. You can connect them with recovery support, and that it would include inpatient, outpatient, peer mentor programs, things like that, recovery centers. A really important component to these two sections is that the provider follows up and offers connections with resources or assistance. And you can see all the way on the bottom right, does the provider's organization or facility have the opportunity for tours of labor and delivery or of the NICU if they're anticipating a NICU stay? So that's just a little sneak peek of our pregnancy plan. You'll be able to download that yourself. This is the full training series that we have planned over the next 2 months. This QR code will take you to our SUD resource hub, as I mentioned before. That's where you can download the resources that we have made in partnership with our patient family partners. But there is a huge bank of resources that we have vetted and that are from trusted partners. And they are broken down by national resources, local resources. There are resources that have been provided and shared out state by state from state PQCs. So we invite you to take a look at that website, and we hope that you would like to join us for our last two webinars. The next one will be on May 22nd. And our SUD Resource Hub also has the place where you can register for those final two webinars. And our next one is also going to be about patient-centric screening processes. Okay, so that takes us to the end of our webinar. I would love to open this up for questions, and you can ask your questions in one of two ways. So you are welcome to come off mute and ask your question, or you are welcome to include them in the chat. I see a lot of activity in the chat. I'm so glad that you guys were all joining and sharing where you're from. Oh, I see folks from all over. If you have questions, please include them there. I'm going to make sure, I'm hoping that I don't miss any as I'm looking at these. And I see some of my colleagues have been answering some of the questions in the chat. Thank you so much. Will the pregnancy planner template tool be sent out? The PDF on the website. Yes, it is an implementation guide, and that's a PDF. We are working to make these resources editable for you, so that's going to be coming soon. Right now, they are PDF versions for you. And Carol, I saw that you said you're not seeing the document. We'll make sure. Oh, Lainey responded. Thank you so much. So Lainey explained in our chat that if you scroll down, you'll see a resources section, and that's where the pregnancy plan is, and you'll see the downloadable resource. Thank you all for your patience as we're trying to make sure that you guys can access everything. Thank you, Caitlin. We appreciate your patience. I'm going to stay on here because I would love to answer any questions. I'm going to continue to make sure I didn't miss anything in the chat. And if any of my colleagues see a question that I missed, please definitely draw my attention to it. We are so grateful to have you all here. I see you from all over the US. We got North Carolina, Nevada, Alabama. Thank you all so much for coming. Nancy, thank you. So Nancy's question was, she manages Help Me Grow in her county, which includes early childhood home visiting prenatal to 3. Can we use this prenatally for planning? We always talk about birthing plans. That's what we would encourage you to do. And so very often we hear like the birthing plan is so focused on what happens during the birth itself. And that's why we really kind of tried to shift the perspective and call this a pregnancy plan so that it was intended to be used throughout the care of the prenatal care for patients. So we would encourage you, yeah, use it throughout the duration of the pregnancy. Okay, Shelby, this is a great question. So her question was for colleagues on the call who work in acute care, how do you tap into the plan before or at admission of a birthing person? And I know that that is different for all facilities and for all hospitals. So I am going to flip that question to the audience. If anybody has any suggestions on how they access cares like plans like that, we would love to learn from you. Oh, thank you, Nancy. And my colleague Lainey just dropped a direct link to the SUD resource hub in here. In case you didn't catch the QR code, I will back up one just in case people wanted to grab that QR code off of their phone. And then she also mentioned this webinar, if you joined and missed a portion of the webinar, we are going to be posting the recording of this. So you can always watch it. And if you feel like this might be helpful for one of your colleagues to see, please do that. So I wanted to reiterate one last thing, and that is we welcome your feedback. So if you notice aspects of this pregnancy plan that maybe you think the language should be tweaked a little bit, if you think something should be added in there, and it's really important, you are there working with facilities, you are working with patients, and we would like to learn from you. So you can email us at our Mama's Voices email address. And I think one of my colleagues hopefully will drop in our general Mama's Voices email address into the chat. And we will welcome your feedback and we will do our best to capture your best practices in our document. Thank you so much, Nicole. Appreciate that.
Thank you so much. This is Nancy in Ohio, and the timing is just awesome. I'm so glad I jumped on this because I took a call from our local women's recovery center just a little while ago and to enroll 3 pregnant moms that are in recovery. So this is just like a perfect follow-up to having that phone call. So thank you so much.
Oh, Nancy, thank you so much. And honestly, as you introduce this to your patients, we welcome your patient's feedback. So if you are comfortable asking them, is this helpful? Is there anything you feel like belongs in here? We worked with our small work group over the course of 2 months to kind of construct what this looks like. But you're in your own area and you have your own population of people. So we would love to learn from you and we would love to hear what you think would be helpful.
Thank you.
Oh, Carol, thank you so much. You're a perinatal peer counselor and you work with Michigan's Peer Navigator program through MDHHS. Oh, I'm so glad. So the plan of safe care, that's wonderful. Thank you for sharing. I'm going to continue to stay in the chat if anybody has questions. Again, I also invite you if you would like to come off mute and ask questions. You can also ask questions not just of me or of my colleagues, but of each other, just like we saw the question earlier. And not sure if I saw a response in there, but the question was, how do people access something like this in their facility if they're in acute care? So if any of you have an answer to that, please, you're welcome to come off mute, or you're also welcome to include that in the chat. Karen, I'm noticing your question from about 10 minutes ago. You said too often doctors ask patients if they have any questions without them having foundational information. Yeah, I was asked a lot of questions, yes, no questions, and I didn't really know what I was answering sometimes. So any opportunity we have to ask those open-ended questions and give them the chance to say, I'd like more information about that. It's a way to invite them to ask without them having to say, I don't know anything about this topic. So we're just trying to make the dialogue and communication open. Oh, Callie, thank you so much. You're a doula. Oh, we appreciate you being here and a community health worker in Maryland. Oh, thank you so much for considering sharing this with the OB doctors. We also would love to hear from you how that works out and if they have suggestions. I echo what Lainey said. We love our doula community.
And that was the point that this is Karen. That was the point that I was making with my statement. All too often, when patients and or birthing couples go into that space, one of the doctor does what the doctor does, and then they say, do you have any questions? And one of the things that I share, I'm also a doula in addition to a clinical social worker. And one of the things that I share with my patients are that the doctor is like a salesperson, and you are there to buy a Tesla, and you know absolutely nothing about a Tesla, and it's their job to give you as much information about purchasing a Tesla so that you want to be there and purchase it from them. What I like about this tool is if this tool is used proactively prior to them actually attending an appointment, it gives them the open-ended questions that they can ask and get more information about. But more importantly, they can say, I have this tool and I'd like to go through some of the questions that are on here with you. And it empowers them to do that. But more importantly, it makes the provider accountable for dialoguing with them and not doing a checklist or just giving do you have any questions? Because if this is their first pregnancy, they may not have the foundational base to ask questions. But even if it's not their first pregnancy, according to how many traumas they've been through and or where they are currently in their recovery and or just in their mental space, this tool gives them the ability to connect with questions that they may have not asked before. But more importantly, I'm going to stay in this position, making providers be accountable to not doing a checklist, but actually building a relationship that transforms the pregnancy into a healthier experience.
Thank you so much for sharing that, Karen. I could not agree more with you. And it's all about opening up that communication so that when there is a concern, they're not afraid to speak up. A lot of parents, when you mentioned whether it's a first time mom or not, every pregnancy is unique and every pregnancy is different. And we sometimes tend to second guess ourselves. If something's not feeling right, but I'm sure it's just me. But if you already have a really comfortable communication pattern with your provider, you're much more likely to ask them questions or to pick up the phone and reach out to their office if you need to. I love that analogy of a salesperson and a person walking in to buy a car. If I think about myself and my husband, we have very different car knowledge. I don't have a lot of knowledge about cars. So if I was going in to buy a car, I wouldn't even know what to ask. I don't know what I don't know. And so you're right. Like we were hoping that this would at least open the opportunity for them to ask for information, even if it was something they never would have known about before. I might borrow that, Karen, that car salesperson analogy. I love that. Oh, thank you, Callie. Appreciate all the love. We love our doula community. I'm going to stay on if anybody has any other questions or if any of you would like to ask each other questions. We're going to stay on here. But if you don't have any questions, we wish you all the best as you are supporting patients. If you're with a PQC, as you are supporting the broader organizations, we are here every step of the way. Take a look at our SUD Resource Center. We are really excited to have a central location where you can go for all of it, not just for the resources that we created, but for the resources that other folks have created so that you don't have to go and piecemeal and identify it for yourself. And if you've never connected with Mama's Voices before, you can always go to our website and then see all the wonderful things that we do. I'm a little biased there, but well, thank you, Karen. Thank you so much, Shelby. Thank you, Nancy. Oh, we appreciate all the love. You guys are wonderful.